Hello guys, hope you all are doing well. Welcome back to my channel. This is Rima again. I'm here today with new video. Today's video is gonna be on the interview questions in hospital setting. I have not been able to make any new videos recently due to my personal reasons, but I hope I will be making new videos now every week. If you guys have been watching my video, you already know I make the nursing related videos, and if you like the videos watching related to nursing in Australia, then please like my channel, comment on it and subscribe my channel. I also have a TikTok where you can follow me and ask me questions if you have any, and you can also follow me on Instagram where you can also ask me or send me any questions related to you. I am very thankful that you guys loved my interview questions in aged care settings. So I'm making this new video in interview questions in hospital setting. Hope this video would also be helpful as like that of aged care setting. I have targeted the new grad and the overseas nurses who wants to work in the hospital setting. So let's not delay and start the video. For the disclaimer, I would like to say these are the questions that I experienced when I was doing my RN interview for hospital setting, and I would also encourage you guys to do your own research and find another questions or other questions that are related to the field. So I'm just sharing my knowledge and experience. Hope you would like this video too. So the hospital uses the 6 selection criteria to ask you the questions. So all the questions that will be asked in your interview questions are usually given from these 6 selection criteria, where it includes different types of question under each criteria. And this is taken from New South Wales Health GradStart Handbook 2026, which we can also refer for all type of the questions that you will be asked for. So criteria number 1 is demonstrating the understanding of NSW's health core values, where C refers to collaboration, O refers to openness, R refers to respect, and E refers to empowerment. How will you use the core values to deal with the patient or to relate with the patient? So here the collaboration, you can say you will collaborate with the different team members such as allied health or doctors to promote and to provide the safe care to the patient. You will also collaborate with the patients themselves to involve them in the activities or the procedures that are important for them. For the openness, you would say you would always maintain the open disclosure if there is any incident that happened to the person, such as medication errors, or you are always open to the constructive feedback you receive from the patient or the families. You would, no matter the race, no matter the religion, no matter the ethnicity, you will always treat everyone with respect and promote their dignity while they are under your care, or like respecting each other's in a team. That's how you will demonstrate respect. And for empowerment, you will always involve in the activities, or you will always involve in the educational activities, seminars to promote yourself or to promote your patient safety, or to develop your personal abilities. So that's how you will relate the core values with your patient. So now let's not delay and move to the criteria 2, demonstrated high level interpersonal, written and verbal communication skills. So based on the topic, you can already say the questions related to the communication skills that you possess will be asked, and the personal qualities or the professional qualities you have as a RN will be asked. So these questions are not hard. You can already say what are the qualities you possess, such as you are empathetic, you are a good listener, you are always willing to learn, you will practice within your scope of practice, you are honest, punctual, you are always polite, you treat others with respect and dignity, and you are always a good team player. You can advocate for your patient, you have good verbal, written communication skills, you have good computer literacy skills. Similarly, you can also say you understand the non-verbal cues, you have a good problem solving skills, you are a good listener, you are always keen to learn, and such. Another questions that may be asked within it, like how will you talk with a person with non-English speaking background, or have developmental delays, or age a child, or how are you going to talk with the person having visual impairment, hearing impairment and such. So in such case, you can always say you will assess the level of the understanding or level of the English or level of the disability the person has, and you will organize a therapist, or you will organize an interpreter depending on what you need. For small tasks such as eating, drinking, showering, you will create a non-verbal card cues, or you will create the communication card cues that you can use to communicate with the person when there is no one around, like families, and to provide the information in regards of their health. And you will organize the interpreter. You will involve the family members to ensure they understand, or you will ask the interpreter to ensure that the person understand what you are saying and all. And for the developmental delays as well, you will involve the therapist, you will involve the families, like how you can portray or how you can provide all the cares information that are needed. You can also say you can use the pictures, diagrams, or charts to make the children or to make the person with disability understand what you are talking about. And you can use the visual aids. You will maintain the confidentiality of the person and provide the privacy, and maintain that you will seek the assistance from the family or the carers. Ask the person or provide the reassurance or ensure that the person have understand everything that you have said and all. And you will document everything that you have done. So these are the things that you will need to ensure you do it with developmentally delayed or the person with any disability or non-English speaking background. So in here basically they will ask you like what kind of communication skills you possess, what are the qualities or the role you have as an RN, and how will you deal with the person who have no English speaking background or have developmental delays or certain kind of disabilities. Let's move to the criteria, which is demonstrated clinical knowledge and problem solving abilities. Here as well the questions can be direct or scenario based. In this criteria you will be asked questions related to different kind of diseases or conditions such as fall management, how to deal with unresponsive patient, how to deal the chest pain, how to deal with hypertension, hypoglycemia, and aggressive patient, mental health related patients such as suicidal ideation, absconded patient, aggressive patients. The questions may also be depending on what kind of facilities you are going to work for. Like suppose if you have applied for the neurology ward, then they may ask you about the questions related to the stroke, seizures. And if you have applied for the gastroenterology, they may be asking about you like GI bleeding, and also about the melinas, angitube, peg tube. And also depending on the facility or depending on the department you have applied for, the questions may be based on the departments, or if you are the new grad, then it may be the questions may be general. For knowledge based question, the another questions that can be asked directly to you is when you're answering a call bell, you found the patient is lying on the floor and is having active bleeding from the head. What will you do in such scenario? So in such scenario you would say like, I will ensure the safety of myself and my patient, I will call for the help, I will use the doctor's ABC, I will assess the danger, I will respond, and then I will assess the airway, I will assess the breathing, I will assess the bleeding. I will ensure I do the neurological assessment, vital signs, try to stop the bleeding. I will ensure I use the proper PPE for the infection control. I will ensure that I maintain the privacy and dignity post-incident, and I will do the incident report, notify the doctor's family, reassure the patient. I will ensure I do the proper manual handling technique. Similarly, they would ask you if you walk into the unresponsive patient, what will you do and how will you do? So the answers would be similar. And then similarly, they may ask you, you are starting your shift and you found out that one of your patient is missing. What would you do? The patient has a mental health condition or something like that. Then what will you do? You would first ensure the patient has not gone for any appointments or any kind of procedures. Look through your ward. You also check their room, toilets, talk with their family, ask them if they are with them or gone for the walk. After ruling out everything, if you still can't find the man, then inform the team leader. Team leader may need to involve the police if the person is danger to self or others, and you also need to alert the hospital security so that they can also have a look, give the description of the patient, so it's easy for them to find him or her, and do the incident, and open disclosure to the team leader, service manager, and family, and do the incident. So those are all in the criteria too. So depends what questions would be asked. I'm not going to deep dive in each of the conditions that I just talked about. I'm just going to say in here the questions may be prioritization based as well. So for example, if an interviewer asks you have a patient with a low blood sugar, another patient who is complaining about the swelling in the IV site, you have an anxious patient who is asking to see you, how would you prioritize this patient? So the answer is simple. There is no right or wrong answers. You should be able to justify the answers and demonstrate the appropriate problem solving skills. You need to show the prioritization and delegation skill. You can ask the AIN to help you as well, or ask your colleague to help you. You can also ask the follow-up with other appropriate teams such as doctors or admins or team leader or allied health. And depending on the scope of practice, I would prioritize the delegation. I will document all the care that I did during the shift, and I will also reflect on my action, what should have been done or what should have been best. So when the questions are given priority based and there is no any right answer or wrong answer, you just have to provide the rationale why you are going to how you are going to prioritize the care and why. And in here you should be able to know how to delegate the task, and how to ask for the help, or how to share the workload so that you can manage your work properly, you can have the time management properly, and you will have to have the knowledge of the certain conditions where your initial response is required. Similarly, number 4 criteria is demonstrated ability to work in a team or multidisciplinary team. Here as well, the questions can be direct or scenario based. The person may ask you, as a registered nurse, how can you contribute to a positive team environment? So you can say you will work towards the common goal, you will have a good communication between the team, you will help to lighten the burden of the team by sharing responsibilities of the patient or by sharing the workload. You would respect the seniors and love the juniors. You would be accountable and responsible for the jobs you do or the things you do. You will carry the positive attitude and be hardworking. So that's how you can build a positive team, or you can contribute to build a positive team. Criteria 5, it is about the understanding of the professional, ethical and legal requirements of the registered nurses. Here the questions can be direct or scenario based as well. Here the knowledge would be asked based on the dangerous drugs such as S4, S8, their management, consents, accountability, rights of medications, safety of patient, refusal of cares or medications, managing complaint, unprofessional manners, and so on. So the questions can be both direct and scenario based as well. They may ask you, a person is scheduled for the surgery or invasive procedure, what are the things that you will need to check as an RN? So you would say, you check the hospital policy and procedures for information regarding the procedure. You will check if the person have given the valid consent or not. If not, you will inform the team leader, supervisor and the medical officer. You will assist the patient if they are ready for the procedure, if their condition is stable for the procedure. You would administer all the pre-medications that are required. You would reassure the patient to make sure or ensure the patient knows what the procedure is going to be done, and if they are ready. You would check the vital signs. You would ensure to document all the things that you have done during the shift. You will also do the patient identification check. Similarly, another situation can be you are going to do a blood transfusion for a patient, but you noted that there is no consent form for the patient. What will you do in such scenario? So you can say, assist the patient, look for the consent paper, ask if they have already filled the consent paper or they have not filled the consent paper. If not, ask the medical officer to do it. Ensure your patient knows what procedures we are going to do. Ask them if they are happy for the blood transfusion, if they know what blood transfusion is, If they refuse, ensure why they are refusing it, what is the reason behind the refusal. Ensure you explain the procedure, its importance, and consequences of not doing it. And be compassionate and respectful. Remember the right to refusal, right to education, and then do the incident form if required, and do the proper documentation and inform your team lead. Similarly, they may also ask you about the asset. You are doing asset with a colleague, and then they have to live in between while you are doing the asset with them. What are you going to do next? So you will say you won't administer the medication until the second nurse arrives. You need to exhibit the 5 rights of medications. You need to find someone else to check with, such as other the RN, educator, or medication endorsed EN, and ensure the medication is correctly signed and checked in the medication book as well. And be aware of the hospital procedures, policy, and protocols of medication administration. Here they may also ask you how can you resolve the conflict between the 2 colleagues, or between you or your colleague, or between you or your senior colleague. So you can just say, like, you will talk with the colleague, colleague who have problem with you. You will approach the colleague in a private place. You can say you will ascertain the issues, speak to the colleague in a private place, listen to what colleague has to say. Try to look to the issues from the point of view of the colleague as well. Discuss the issue and try to resolve with the colleague. Be open, not non-judgmental, and do not use a language or sign that may be aggressive. If unable to resolve the issues, discuss with the nurse unit manager or the team leader. Reflect on the reason why the problem is not solved, or what could have been done to resolve the issues. Similarly, seek for the assistance or the guidance or the employee assistance program as needed. Similarly, they would ask you, like, someone is giving you the cash because you provided a very good care to the patient. What will you do in such situation? And also, I think everyone knows what to do in such situation. Like, do not accept any cash. Just ask them, it's not ethically good, and then it was your responsibility as a nurse to provide the good care, and then you're happy that they think you are providing the good care. Share it with the team leader, whatever happened. And yeah, that's all. So these are questions that are related to the criteria. So now let's move to the criteria. Number 6, this standard is easy to talk with because it includes the things such as how will you develop yourself professionally and personally, like participating in an educational activities, and doing your CPD hours, completing your continuous professional development programs. It is to ensure how you will be developing your career, or how will you be developing yourself professionally and personally by involving or by participating in the educational programs, seminars, and educational activities provided by your hospitals. And this also includes the work health safety, and how will you follow the protocols for the proper manual handling, how will you act when there is an outbreak in your facility, or will you control the infection by implementing control measures or the precaution measures, and all. They will ask you how will you implement your standards in your clinical role. These are the things that will fall on this section. So these are all the questions that will be asked during your interview questions. Just make sure you go through the handbook, and these are the 6 criteria that are important for you to know what are the questions that will be asked to you. Being an overseas RN, it is also important for you to be familiar with National Safety and Quality Health Services, which is also called as NSQHS Standards. These standards are to protect the public from harm and improve the quality of healthcare services. These standards are also similar to the criteria of the interview questions. Apart from this, it is important to have the knowledge-based questions. So thank you so much for watching the video until the end. I hope this video has been helpful. Get to follow me on TikTok and Instagram. If you have any questions, you can DM me over there. And please don't forget to like, comment, and subscribe my channel. I hope this video has also been helpful, and all the best to you if you are going to give RN interviews in any setting. I hope to see you in my next video. Bye for now.